We've all been there. That sinking feeling when a new breakout appears right before a big event. You've tried every miracle product, scrubbed your face until it's raw, and maybe even sworn off your favorite foods, all in the quest for clear skin. But what if the battle against acne isn't about fighting your skin, but finally understanding it? This video will help you to decode breakouts, from the invisible hormonal shifts and genetic codes that trigger them to the powerful, science-backed strategies that can finally bring you peace and the clear, healthy skin you deserve. To effectively combat acne, it's crucial to first understand how it develops deep within the skin. Our skin is covered in tiny holes called pores, which serve as openings for hair follicles. These pores connect to sebaceous glands, the microscopic organs responsible for producing an oily, waxy substance called sebum. In a balanced state, sebum is beneficial, keeping our skin moisturized and protected. Problems arise when these pores become clogged with a mixture of excess sebum, dead skin cells that haven't been shed properly, and sometimes bacteria. This blockage is the starting point for all acne lesions. Several factors can contribute to this process, but hormonal fluctuations, particularly the surge during puberty, pregnancy, or menstruation, are a primary driver of increased sebum production. Furthermore, genetics play a significant role, as some individuals are simply born with a predisposition to having more active sebaceous glands. Acne is not a monolithic condition. It manifests in various forms, and understanding the different types is essential for choosing the most effective treatment. Firstly, there are non-inflammatory lesions known as comedones. Blackheads, or open comedones, are small bumps that appear dark on the surface, not because of trapped dirt, but due to the oxidation of the sebum and skin cells when exposed to air. Whiteheads, or closed comedones, are similar but have a closed surface, giving them a white or flesh-colored appearance. Then we have inflammatory acne, which is often more noticeable and painful. Papules are small, red, tender bumps that signal inflammation. Pustules, commonly known as pimples, are similar to papules but are filled with pus, a combination of dead white blood cells, bacteria, and debris. These lesions require careful management to prevent the risk of scarring. Let's delve deeper into the role of hormones, the chemical messengers that control so many of our bodily functions. Hormones sit at the control panel, especially androgens like testosterone that tell sebaceous glands to enlarge and secrete more oil. During puberty, androgens spike and the glands swell. No mystery why teenage skin gets louder. But the hormonal story doesn't end at graduation. Many people who menstruate notice a repeatable pattern: relatively calm skin mid-cycle, then a pre-period flare along the jawline, chin, or neck when estrogen and progesterone dip and the androgen influence becomes comparatively stronger. Pregnancy can swing things in either direction. Glowingly clear for some, stubbornly clogged for others, and the postpartum period, with its hormonal whiplash and sleeplessness, tends to be unpredictable. Menopause can reawaken acne in skin that hasn't broken out in years because shifts in estrogen leave androgen effects more pronounced. There are endocrine conditions like PCOS that keep androgens chronically high, or insulin resistance that nudges oil production by stimulating IGF-1 signaling. Then there's stress. Cortisol doesn't smear oil onto your face, but it disrupts the skin barrier, affects wound healing, and can push inflammatory pathways into overdrive. Short sleep habits twist the same knobs. Even certain medications, steroids, lithium, some progestin-only contraceptives, can tilt the balance toward breakouts. The point is not to memorize every hormone but to track your own rhythm. If your skin flares predictably, that's not failure. It's a map. Bacteria are not villains so much as opportunists. Cutibacterium acnes, formerly Propionibacterium acnes, lives on healthy skin and usually minds its business. Give it a clogged, low-oxygen pore packed with triglyceride-rich sebum, and its preferred strains multiply. As they digest sebum, they release byproducts that can irritate the follicle. The immune system, hyperattentive and protective, rushes in. White blood cells flood the area and release chemical signals that drive redness, swelling, and pain. That's inflammation, and it's why harsh scrubbing often backfires. You're adding more injury to a system already on high alert. It's also why antibiotics, while sometimes helpful in short bursts, aren't the whole answer. You're not trying to sterilize your face, You're trying to calm a community and reopen a blocked pathway. Medically, that's why benzoyl peroxide is often paired with antibiotics to limit resistance, and why retinoids, which normalize cell turnover, are foundational. Reduce the plug, balance the oil, keep the pathway moving, and the bacterial party has nowhere to throw confetti. Genetics hum steadily in the background. If your parents battled breakouts, your odds go up. That doesn't mean a single acne gene haunts you. It means you might inherit sebaceous glands that are a bit more ambitious, keratinocytes that cling a bit longer before releasing, or an immune system that reacts more vigorously to follicular changes. You might inherit the size of your pores, the speed of your baseline cell turnover, how easy it is for your skin to hold on to hydration, or how reactive your skin becomes under friction. You can't edit the blueprint you were born with, but you can furnish the house wisely. Maintain a healthy barrier, respect your skin's tolerance, and choose active ingredients that answer your specific pattern rather than every trend on the shelf. While we're here, let's retire a few myths. Chocolate alone doesn't curse your face. Greasy food on your plate does not magically become grease in your pores. And dirty skin is not the cause of acne. In fact, over-cleansing or using gritty scrubs and stripping toners can escalate breakouts by damaging the barrier and provoking compensatory oil. Acne isn't a hygiene problem. It's a biological one with behavioral amplifiers. So what do you do, gently, consistently, effectively, when a face is human, not photoshopped? Start with a cleanser you can live with twice a day. If you wear makeup or mineral sunscreen, massage a balm or light oil cleanser onto dry skin at night, emulsify with water, then follow with a gentle, pH-balanced water-based cleanser. Morning can be simpler, a rinse or the same mild cleanser. Avoid hot water, lukewarm cooperates. Then pick a leave-on active that fits your type. Salicylic acid at around 2% can dive into pores, dissolving the oil cell mix that forms plugs. It shines with blackheads and whiteheads. Benzoyl peroxide between 2 and 5% kills bacteria and reduces inflammation. Lower strengths can be as effective as higher with less irritation. Use as a short contact therapy in the cleanser step or as a thin leave-on in breakout-prone areas. Azelaic acid at 10 to 15% is a quiet hero. It has antimicrobial and anti-inflammatory properties, gently unclogs, helps with redness, and fades post-inflammatory pigment. Adapalene, an over-the-counter retinoid, normalizes shedding and keeps pores from clogging. Use a pea-sized amount for the whole face, applied to completely dry skin. Then buffer with moisturizer if you're sensitive. Niacinamide, around 4 to 5%, supports the barrier, moderates oil, and calms redness. It's a great teammate rather than a soloist. Sulfur washes or masks can help with feels like a volcano moments by tamping down oil and inflammation. The order matters less than consistency and tolerance. One strong active used well beats 4 layered haphazardly. Moisturize even if you're oily. Dehydration provokes more oil, not less. Look for non-comedogenic, lightweight gels or creams with humectants like glycerin and hyaluronic acid plus barrier-loving ceramides. Finish with sunscreen every morning, broad-spectrum SPF 30 or higher, because many acne actives increase sun sensitivity, and UV exposure deepens the dark marks that linger after a pimple. When over-the-counter lanes aren't enough, or when nodules and cysts crash the party, see a dermatologist. Prescription retinoids like tretinoin, tazarotene, or trifarotene pack more punch and, when introduced methodically, can transform the terrain by preventing new clogs and dialing down inflammation. Topical antibiotics such as clindamycin or erythromycin, ideally paired with benzoyl peroxide to minimize resistance, can help during flare windows. Oral antibiotics like doxycycline or minocycline are short-term tools, not lifestyle choices, think weeks to a few months, to quiet inflammation while your topical routine stabilizes the system. For hormonally driven acne, especially jawline and premenstrual flares, combined oral contraceptives or antiandrogens like spironolactone may regulate the oil signal from inside. These require medical screening and aren't for everyone. Severe, scarring acne that laughs in the face of everything else may respond to isotretinoin, a powerful oral retinoid that shrinks sebaceous glands at the source and can deliver long remissions. It demands careful monitoring, strict pregnancy prevention, and regular labs. In-office procedures can complement medication. Chemical peels help clear comedones and brighten texture. Blue and red light therapies target bacteria and inflammation. Photodynamic therapy can suppress oil gland activity. Intralesional steroid injections deflate individual cysts quickly and reduce scarring risk. None of this is a moral referendum on your skin. It's a menu. Your choice depends on severity, tolerance, life stage, and goals. Lifestyle tweaks won't cure acne alone, but they change the background noise. Diet is a nuanced player. Patterns of high glycemic eating, frequent blood sugar spikes, may ramp up insulin and IGF-1, nudging oil production and inflammation, while some people notice flares with skim milk or whey protein, possibly due to bioactive molecules and the way they interact with hormones. Others notice no difference at all. Rather than demonizing single foods, treat your skin like it benefits from the same steady, not too processed, protein and fiber-balanced meals that make the rest of your body hum. Train, sweat, live your life, but rinse sweat off your face and body soon after workouts. Switch out of tight, damp clothes, and choose breathable fabrics. Hair products can travel. Heavy pomades and silicone-rich stylers migrate onto your forehead, temples, and back. Pomade acne is real, so aim them away from skin or switch to lighter formulas. Wash pillowcases and hats regularly. Wash makeup brushes. Go easy on occlusive layers if you're already oily. Friction matters. Masks, helmet straps, chin rests, violin chins, sports gear. Micro-rubs can inflame follicles, so add a thin layer of bland moisturizer under those pressure points and clean gear often. Sleep and stress management aren't Instagram luxuries. They meaningfully shift inflammatory tone and barrier repair. None of this is about becoming perfect. It's about trimming a few loud triggers so your treatments don't have to shout. Post-breakout marks deserve their own compassion. What lingers after a pimple can look very different. Brownish or tan patches, post-inflammatory hyperpigmentation, from increased melanin, flat pink or red marks, post-inflammatory erythema, from dilated surface vessels, or true scars where collagen architecture changed. Ice pick, narrow, deep, box scar, wider, well-defined edges, and rolling, soft, undulating. You treat each differently. Hyperpigmentation fades faster with strict sunscreen plus pigment-friendly actives. Azelaic acid, retinoids, vitamin C derivatives if tolerated, and patience. Erythema responds to time, sun protection, gentle routines. Vascular lasers can help if it's stubborn. True scars are architecture problems. Topical creams won't rebuild them. That's where in-office work shines. Microneedling to stimulate collagen, TCA cross for ice pick scars, subcision to release tethered rolling depressions, sometimes paired with fillers and fractionated lasers to resurface. The fallback prevention is boring but gold. Don't pick. If you're a picker, pretend your future self is watching because they are the one who wears the scar. If a lesion is screaming, a pimple patch can physically remind your fingers to back off and provide a moist healing environment. When a cyst rises like a planet, ask for a quick steroid injection. It's often the difference between a week of swelling and a month of drama. Through it all, keep the routine simple and specific. At night, cleanse, apply your active, rotate or stack thoughtfully, moisturize. In the morning, cleanse if needed, layer a calming serum if you like, moisturize, sunscreen. Introduce one new product at a time and give it at least 8 to 12 weeks unless you're clearly reacting. What looks like a purge the first 2 weeks may be your follicles clearing, not a product causing acne. If your skin stings or peels aggressively, you're not being strong. You're injuring the barrier, and injured skin breaks out more. If you like a tangible plan, here's a gentle, realistic arc week 1 to 2. Choose a low irritation cleanser. A single leave-on active that matches your breakout type, salicylic acid for comedones or benzoyl peroxide for inflamed acne. A non-comedogenic moisturizer, and a sunscreen you'll actually wear. Don't stack everything at once. Consistency outruns intensity. Week 3 to 4. If tolerated, layer in adapalene at night 2 to 3 times a week, sandwiching with moisturizer to reduce irritation. Consider azelaic acid on mornings when you're not using other actives. Week 5 to 8. Nudge frequencies up if your skin is calm. Rotate benzoyl peroxide to areas that erupt predictably, jawline, back, as a thin preventive film. Keep sunscreen daily. Expect fewer new lesions and quicker healing of old ones. If by week 10 you still have numerous painful nodules or widespread inflammatory lesions, or if body acne is severe, book with a dermatologist. Strong tools exist, and you deserve relief. Through every step, remember that your skin is an organ that wants to heal. Your job is to give it fewer fires to put out and better tools to do its job. Cleanse without punishment. Treat without panic. Moisturize without fear. Protect without exception. And then there's the quiet part we don't say out loud. Acne can be lonely. It can make you dread cameras, dates, interviews, and the kindness of your own bathroom mirror. It can turn your face into a math problem you never stop solving. If that's you, know this: you're not broken. Billions of humans, across countries, ages, genders, and histories, have looked at their skin and felt that same ache. Clear skin is not a virtue, and a breakout is not a sin. You're allowed to want calm skin because it makes your life easier, not because it makes you better. You're allowed to advocate for care, to ask for prescriptions, to budget for procedures, to say no to routines that hurt, and to yes to the slow, boring, kind habits that actually work. If you stumble, you're human. Start again. If you heal, celebrate without waiting for perfection. The day will come when the emergency brakes stop, when your routine is muscle memory, when a pimple is just a blip, not a story. That's not magic. That's you learning your skin's language and choosing over and over to speak back with patience, clarity, and respect. If you enjoyed this guide, make sure to like the video, subscribe to the channel, and turn on the bell so you don't miss future uploads.